Alright, this is the spinal immobilization skill station. BSI scene safe. So we're going to take C-spine precautions. I'm going to direct my partner to hold C-spine in a neutral inline position. Sir, are you okay? Patient is unresponsive. I'm going to check the radial pulses. Radial pulses are strong. Sir, can you squeeze my hands? No response. Sir, can you tell which fingers I'm touching? No response. So what I'm going to do is I'm going to move down to the lower extremities, assessing pedal pulses. Pedal pulses are strong. Sir, can you push against my hands with your feet? No response. Sir, can you tell which toe I'm touching? And patient is still unresponsive. So what I'm going to do is I'm going to apply a C-collar. We're going to backboard this patient. So what I'm going to do is I'm going to have a partner come in. You're going to place your left hand on the upper hip and your right hand on the lower leg. And I'm going to place my left hand on the shoulder and my right hand on the lower hip. And on the heads count, we're going to log roll the patient towards us.
So on 3, 1, 2, 3.
All right, so I'm going to check the back for any step-ups or any bleeding, any life threats. I'm not seeing anything, so what I'm going to do is I'm going to pull the backboard in. And then on the heads count, we are going to lower the patient onto the backboard.
So on 3, 1, 2, 3.
All right, so I don't really like the positioning of where the patient is on the backboard, so what we're going to do is we're going to move the patient down and to the patient's left, grab onto the hips, and I'm going to hold onto the shoulders. We'll move on the heads count.
1, 2, 3.
All right, and then we're going to move up. On the backboard, on the heads count, I'm going to go underneath the armpits now, and you're going to keep your hands on the hip.
1, 2, 3.
All right. And so I'm going to go underneath the arms, starting with the chest. To secure the patient to the backboard. Kind of just going over the chest. And then I'm going to avoid any joints. And then I'm going to remove a little snag hazard, just tucking in some of the straps out of the way. And then I'm going to put head blocks on just a little bit. And then I'm going to secure the head to the blocks into the board using a head strap. And then next a chin strap. And then I'm going to reassess CMS. All right. Radial pulses are intact. Sir, can you tell which fingers I'm touching? Patient is still unresponsive. Can you squeeze my hands? Still unresponsive. All right. I'm going to assess pedal pulses. Pedal pulses are still intact. Sir, can you push against my hands with your feet? Sir, can you tell which toes I'm touching? Patient is still unresponsive. This would be a high priority transport. If the patient were conscious and was experiencing pain, I would treat with fentanyl, 1 microgram per kilogram. Patient started exhibiting signs of shock. I would treat for shock, administering high flow oxygen, keeping the patient flat, and then trying to keep them as warm as possible. And again, this would be a high priority transport.